Question number 8, the Honourable Maryan Street.
Thank you, Mr. Speaker. My question is to the Minister of Health and asks, is he satisfied that New Zealand women and children are receiving better, sooner and more convenient health care?
The Honourable Tony Ryle.
Certainly yes overall, in no small part due to the extra $2 billion of funding that this government has invested into public health services. Just one example is the government increasing funding for maternity services by over $114 million over 4 years, and in the last budget invested $14 million in Section 88 fee increases for lead maternity carers.
The Honourable Maryan Street.
In light of that answer, Mr. Speaker, to the Minister, is he aware that in 2010 more than 1/3 of all pregnant Pacifica women, just over 1/6 of pregnant Asian women and nearly 1/6 of pregnant Māori women were not seen by a community-based lead maternity carer at all during their pregnancy? And if so, how do the numbers that he has just cited to us aim to improve those rates of midwifery care?
The Honourable Tony Ryle.
Mr. Speaker, the government's doing quite a lot to make sure that we can improve maternity care. What we know is that a large number of women in some parts of the country have their midwifery care provided by the midwives who work in the public hospitals, and that's a model that in some areas of the country the DHBs are trying to move towards greater community provision. But the government certainly is working to support good quality maternity services. We're working very actively with the profession in our maternity safety and quality improvement program, which is achieving a lot for the profession and for New Zealand women and babies.
The Honourable Maryan Street.
Supplementary to the Minister. Is he aware that 5,000 extra children have been admitted into hospital in the last 3 years for preventable conditions such as skin infections and respiratory illnesses? And if he is, to what does he attribute this increase in avoidable hospitalisations, and what is his strategy to address them?
The Honourable Tony Ryle.
Mr. Speaker, the government's acting in a whole lot of areas in order to improve child health. For example, the government has announced a quite significant increase in the amount of funding made available for the free children's after hours program. What we know that for free doctors' visits for children under 6, in the last year of the previous government it was $3 million was spent, and for free doctors' visits for children under 6 today it's 7 times higher at $21 million.
Moana Maki.
Supplementary to the Minister, if things are so great and he's doing so much, then why are Māori babies still 5 times more likely to die from sudden unexplained death in infancy than European babies? Why are Māori and Pacifica mothers still more likely to have stillbirths and neonatal deaths than European mothers? And why are preterm birth rates significantly higher for Māori and Pacifica babies, and what is he doing to address these issues?
The Honourable Tony Ryle.
Mr. Speaker, I'd have to say that that is not a new circumstance that the member can blame on any one party in this House. We are working very closely with the district health boards and the midwifery profession to improve those outcomes, and the government's taking action across a whole lot of preventative health areas which can help support that. For example, our dramatic action to reduce the level of smoking, which does have a dramatic impact on maternity outcomes.
Moroney.
Has he had any submissions or official representations on the issue of Pacifica, Asian and Māori women's access to community-based lead maternity carers from the Minister of Women's Affairs? And if so, has he acted on that advice?
The Honourable Tony Ryle.
Mr. Speaker, I've got to say that the Minister of Women's Affairs and I are discussing matters on a very regular basis, and in fact as recently as yesterday afternoon the Minister of Women's Affairs and I were discussing a whole range of health issues with respect to women.
Point of order, Moroney.
Mr. Speaker, I asked, the question was very specific. I asked if there were any submissions or official representations from the Minister of Women's Affairs. The Minister spoke about some talks that he'd had with her, but I'm not sure of the answer to my question.
Order, I think the Minister did say he had representations from the Minister and that he has discussions with her, and verbal representations are no different from written representations, so I believe he did answer the member's question. Question number 9, Scott Simpson.